Welcome back. Getting the correct hormonal balance can dramatically change your life for the better. And here to explain is Dr. Tutera from the Sotapelli Center and one of his patients, Joanne Benedetto,
Yes.
and Tutera, and I was Toronto. We got a lot of Italians on the couch here. Dr. Tutera, it's good to see you again. Good to see you,
Thanks,
Joanne.
Thank you.
Let's talk about first, you obviously went to go see Dr. Tutera. What was the reasons that you went to go see him in the first place, Joanne?
I just wasn't feeling myself. I didn't have any energy. I just didn't feel right.
You knew you weren't sick, but something just seemed
Exactly.
off. Not
Exactly.
sickness, but just something.
Yeah, I just wasn't right.
Okay.
I just wanted to feel better.
So what did you go and get done then, the hormone replacement?
Yes, I had the Sotapelli hormone replacement
Okay.
that I heard from my massage therapist
Huh. And how long have you been taking those now?
since June.
And what difference have you seen?
Dramatic.
Really?
Dramatic. I feel like I did when I was in my 30s. I have my energy level is back. My thinking is clearer. I'm happier. I just feel a lot better.
And Dr. Tutera, that's pretty common story that you hear, right? What happened,
because,
Joanne?
people come in and they don't know, they can't put their finger on it. They know they're not sick, but yet they can't figure out why they have anxiety and irritability, why there's periods of depression for no good reason that come in. They lose energy. They don't have sexual drive. Their minds are very cloudy, and they come in and they've gone through innumerable number of of opinions from doctors and friends and whatever, and coming in and getting a simple blood test and then having the appropriate therapy so that your body once again can control its own release of hormone just works wonders. And Joanne is a perfect example of many of the patients that we have that have come in and seen a tremendous amount of change in their life.
Well, talk about, I always want to emphasize this because I think this is important. I don't know if you had done this, but when people go to their regular physicians and they say something's not right, I don't know, and they do the blood work, everything looks fine, and they send you on your merry way. But when you look at the blood work, you're looking a little bit deeper, aren't you?
Yeah, you have to, like I've been doing this now for 29 years. I mean, looking at blood work and doing bioidentical hormone replacement. And you have to be able to appreciate, the differences from one person to the next. And you have to understand that not everybody has, the same genetics and the same needs. And lab work has to be interpreted in that manner. And you have to get the proper types of lab work, right, to really make, to solidify that diagnosis.
Did that happen to you, Joanne? Did you go see your regular physician? Did you try other things first and nothing seemed to work? Or?
Not really. What I did was I tried the creams, and they didn't work. And I just, it's really subtle. When you're not feeling right, it's accumulative. Mm-hmm. And you don't realize that you're not right until you feel like you don't even want to get out of bed.
Wow.
I mean, it's just...
It gets to that point.
It gets to that point where, I didn't get to I just felt that I wasn't right.
And what have your friends and family said about it? Have they noticed it, or is it just you?
They heard it in my voice. My sister lives in Boston, and she said, I even hear it in your voice. She came out last week and had it done. She said, I need to do this.
Wow.
And my husband, I asked him from a scale from 1 to 10, what would you think? He said 10.
Wow. Wow. Yeah, usually husbands are a good judge of that. You can ask the husband. And Dr. Tutera, is it anybody, any age, female, male, doesn't matter, right, if you're feeling this way?
Yeah, it can happen at any age. We have patients in their 20s, and we have patients in their 80s. Wow. And there's a wide range. And the reason, that too often physicians, it's not the physician himself, but the system that we're taught is that, women and men, you're too young to have hormone deficiency. Oh, don't do blood work. It doesn't tell you anything. Third one is, which is my favorite, is you can't be in menopause and still have your period, which is absolutely wrong. Okay. And, then of course, the thing about testosterone, it's great for both men and women.